Respected General Manager Shri A.K. Verma, respected President of Servo, Srimati Asha Verma Madam, all the distinguished members of Servo, distinguished PHODs, CHODs, my doctor colleagues, staff of the hospital. Everything has been covered except one part which I am supposed to be looking after as head of the department, that is the expenditure. On a simple basis, a patient with a CV stroke requires much more expenditure to treat. It is a doubly costing situation where the productivity of the employee goes, but he requires 200% care and medications. Similarly, untreated hypertension patient who goes in for a MI, who has to be referred to an outsourced hospital, the expenditure goes in lakhs, whereas his continuous treatment and control of blood pressure over the years can definitely maintain his productivity, maintain his good health, and totally prevent this expenditure of the railways. Similarly, the kidney affection of hypertension, you should visit our hemodialysis center to see the way it is overcrowded. And quite a number of these patients have got untreated hypertension as the cause of their end-stage kidney disease. Here again, the expenditure incurred by railways is much more than the medicines that would have cost for the patient to continue those medicines, modify the lifestyle, and have a healthy life, which would be really cheap for the railways. So, on the other front, I would appeal to my doctor colleagues, to my medical staff, as well as to the distinguished officers and madams who are here. If you come to know that a person is suffering from high blood pressure, please insist that person should have a regular checkup, should continue with medicines regularly. It is not common cold or cough that he takes 7 days medicines and forgets about it. Ab to mujhe acha lag raha, dawa maine band kar diya. No. So that has to be continued, and that has to be imbibed into the person that hypertension is a disease with which you can live healthily if you take the medicines and adopt the proper lifestyle. I don't know, I know I should not preach because I am on the higher side of weight, but then reducing the weight is also essential for blood pressure. The other persons who are also on the other side are laughing at me. So that is another dictum which must be continued, and all those who are still trying, please do. I am also trying to keep down my weight, although I am not so successful because I cannot refuse request of additional help. That is another Indian custom we have of insisting thoda aur le lo, ye kya kuch khaya nahi. So that affection increase to the addition of weight, and that also unduly affects the health. Consumption of alcohol, my colleagues have not been very strict about it due to obvious reasons. But then, yes, once in a while it is, but then official functions, if they keep on occurring very frequently, then you are compelled to keep the company and the protocol, and you have to imbibe. But then, there again, the limit has to be maintained, and the walk the next morning has to be done. So these are the few tips which, as a person who is supposed to provide the money, comes into my mind. It came and I made it known to you. So let us all try to keep ourselves healthy, and at the same time, what sir always keeps on stressing, the expenditure of the railway should be reduced so that finally our performance increases. Thank you.